Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's lecture topic of obstetrics is substance abuse and fetal malpresentation. We divided our lecture into 5 sections. In the first section, we will talk about what are the effects of substance abuse on the pregnancy and what are the different drugs that can be used and that have fatal effect on the pregnancy. And then we will talk about the effects of alcohol abuse also. Then in the second section, we will talk about fetal malpresentation at term. And these fetal malpresentations will be breech presentation mainly. We have two main presentations. One is the cephalic, in which the head comes first, and then in the breech, in which the head comes after. So the malpresentations commonly after is the breech presentation, and then we will talk about what are the different predisposing factors that can lead to breech presentation at term. Then in the third section, we will talk about management of breech presentation. Breech presentations are not easy to deliver normal vaginally. And then if they are, what are the different steps that can be done to manage that breech presentation delivery. So we will talk about external cephalic version in this, also known as ECV, and what are the contraindications and risk of external cephalic version. Then in the fourth section, we will talk about the mode of delivery and then vaginal breech delivery and the management of the breech delivery. Then in the fifth section, we will talk about how we deliver the breech baby, what are the steps that can be performed to deliver the hip, legs, arms, and then the head of the breech baby, and what are the complications and other different fetal malformations or malpresentations besides the breech presentation. So all this will be covered in our today's lecture topic, substance abuse and fetal malpresentations. To learn about this topic, keep watching sqadia.com.